Did you know that cataracts can make you blind? Did you also know that cataract surgery, which is a treatment for cataracts, can also make you blind? If you've been recently diagnosed with cataracts at your eye doctors, or you've been told that you require cataract surgery, and you're so confused you're not sure how to go about it, please let me explain. I am Dr. Patience Adeyakani, a Canadian licensed optometrist and business owner, and today we'll be talking about cataracts, cataract surgery, and how it affects your eyes. What are cataracts? We hear the word all the time. What exactly is a cataract? So we all have a natural lens in our eyes. It's just the way our eyes are. The lens is in your eyes. It's not something you can see when looking at the front part of your eyes, but it's inside your eyes. Light transmits through this lens to the back of your eyes and gets sent to the brain for processing. That's essentially how we see. That's the process. Now, when you're younger, the lens is clear, it's transparent, light goes in, it's all good. But as you get older, usually at about 50, the lens starts to get a bit of color, starts to get cloudy. It's no longer transparent. So what happens is that less light is getting into your eyes, and so your vision starts to get blurry. It's just like having a high quality camera, or even your phone, you have a very good phone, but then you're about to take a picture and the lens on your phone is smeared, it's not clean. And once you take that picture, you will realize that it will be blurry. Remember, your eyes are essentially like a camera, so that's exactly the same thing that happens when the natural lens in your eyes get cloudy. So that's diagnosed as a cataract. Most cataracts are age-related. Did I hear someone say, but my father's 75 years old and doesn't have cataracts? Well, why does Mr. A get cataracts at 50 and Mr. B get cataracts at 80? What is the difference? Well, there's so many factors that can influence how early you get cataracts. A big one is genetics. So some people are just more predisposed to getting cataracts. It's just their genes, it's just the way they're born. There's really nothing they can do about it. Once they're above 50, at some point earlier, they will get cataracts. So we have that. Number 2 is trauma. If you've ever been punched in your eyes, or even kids playing at school, they get a pencil injury in their eye, a penetrating injury, it can develop to into a cataract, essentially. Number 3 factor, which is a big one, is UV rays, ultraviolet rays. UV rays, as we all know from overexposure to sun, isn't the best for your eyes. What happens is that UV rays can cause oxidative stress on the natural lens of your eyes and trigger the formation of a cataract. So that's why I always emphasize, if you go outside, especially if you're living in a warm climate, a very sunny climate, you live in a part of Africa or even anywhere in the world, as long as you're going outside, it's so important for you to wear sunglasses and protect your eyes. Another factor is heavy alcohol intake. If you're a heavy drinker, you drink every day, you're more likely to get early cataracts. So many studies have been done about this and have proven that heavy drinkers are more likely to get cataracts. However, an interesting fact here is that there was one study that was done that actually showed that people that drink red wine actually had less likely to get cataracts. So what does this mean? There's no hard or fast rule to it, but I would say, so if you decided to drink, it's probably a good idea to try red wine instead, as we have seen several benefits of that. But overall, keep it moderate. Heavy drinking is a big no. Another big factor is smoking. Most people don't like to hear this. They say, oh, well, I've been smoking for so long, something must kill someone. It doesn't really matter. But smoking increases your chances of getting early cataracts or cataracts earlier in life. In fact, it increases it by two times. So you're twice as likely to get cataracts earlier if you smoke. Now, an interesting fact of this studies that have been done is that if you actually decided to quit smoking right now, then you would be less likely to get cataracts early. So it's not enough to say I've been smoking or I can't stop. If you actually stop now, then you reduce your chances, which I found to be an interesting fact. Another factor that could lead to early onset cataracts is poor diet. I have a video where I actually spoke about diet and how it affects your eyes. So if you want to go back and watch that video, that would be great. But Worthy of note is that if eating foods rich in vitamin C, vitamin E, lutein, zeaxanthin can protect your eyes, reduce the onset of cataracts. So all these are factors, that come to play in determining who gets cataracts early or not. Another big one is that certain diseases can increase your likelihood of getting cataracts or early onset cataracts. So if you're a diabetic and it's uncontrolled, then you're likely to get early cataracts, because what happens is that increased blood sugar can cause sugar in your lens and trigger a process that would lead to the formation of cataracts. So if you're diabetic, please do your best. It's a tough one. Diet, exercise, try to put that sugar under control. It's not good for you at all. Another reason people can get cataracts earlier is taking certain medication like steroids. If you take steroids like prednisone, these medications can trigger early onset cataracts as well. So if you do have cataracts, what can be done to improve your vision? What exactly, what is the treatment for cataracts? Now, in the early stages of cataracts, what it actually does is that it increases your refractive error. It can increase your refractive error. What that means, it can make you need glasses. So glasses can actually improve your vision, early stages of cataracts. But after a while, as the cataracts progress, then glasses really don't help anymore. And at that point, your eye doctor would say to you, you need cataract surgery. Trust me, a lot of people don't want to hear anything about eye surgery. They go, they're so scared. How can you have surgery on your eyes? Actually, talking about cataract surgery, I would say 95% of my patients that I see in my practice are actually very happy after getting cataract surgery. The benefits most of the time outweighs the risk. I'm going to talk about the risks, but I just want to point out that the benefits of cataract surgery most often outweighs the risk. You have patients that are even older patients, because a lot of people will say, oh, well, I'm 90 years old, why do I need to have cataract surgery? Actually, I've had patients who are 95, even 100, and have gotten cataract surgery. The reason is this: once they get the cataract surgery, it really tremendously increases their quality of life. So whatever, length of life they have left, even if it's 5 years, a couple of years, they are happier, the quality of life increases, they're able to see their children, their grandchildren, and they're more satisfied. So it's actually very uplifting and very liberating. And sometimes they can even start to do activities that they haven't been able to do in a while, so their daily activities kind of just goes up, which is great. But if you've been told you need cataract surgery, what exactly happens during cataract surgery? What can you expect during cataract surgery? Well, interestingly, cataract surgery only takes a couple of minutes. Usually, the procedure itself takes about 15 to 30 minutes, and it's normally done under local anesthesia. So what that means is that you're not put to sleep. So drops are put in your eyes to numb your eyes, and then the surgery is done. I know lots of people are saying, oh my God, does that mean I'll be awake during the surgery? Trust me, it's not as bad as it sounds. So drops are used to numb your eyes. A speculum is used to hold your eyes open, essentially. And then the surgeon during the surgery makes a small incision on your cornea. So this incision can either be done, manually or with laser. I always encourage my patients to get that laser incision, even though it's more expensive, depending on what part of the world you live. But just because it has faster healing, and it's just, better done when it's done with laser. So that small incision is made, and then an ultrasound probe is basically used to break down the natural lens, and it's suctioned out, it's extracted from your eyes. An artificial lens, a clear artificial lens, is put in place of that cloudy lens that was in your eyes. Usually the incision is self-healing, so that heals up, in most cases on its own. And because you now have a clear lens put in, guess what? Light is able to go through your eyes, light is transmitted, and vision is restored. But before the surgery, usually you would go in, you would meet with a specialist, would have a consultation, take some measurements to see exactly what measurements of the lens they need to put in your eyes. They're also going to do a bit more testing, look at the back of your eyes, make sure everything else is great before proceeding with the cataract surgery. Make sure you don't have any ocular surface issues or any other things going on that might lead to complications after the surgery. So usually once the surgery is done, you will expect to wear a patch over the eye. Most surgeons will do one eye at a time because it's just, safer. So they would wait a couple of weeks before doing the other eye. So expect to have a patch over that eye that was done. You will go home that same day. There's no overnight stay at the hospital because you had cataract surgery. Usually you would come back the next day for your first 1 day follow-up. Everything being equal, if there are no complications, there'll be another follow-up in 1 week. And usually in about 3 to 4 weeks, you'll be able to see your optometrist to get glasses if needed after the surgery. There are different kinds of artificial lens that are put in your eyes. Some of these lenses would mean that you may never have to wear glasses again. Maybe they're multifocal lenses, so you can see distance and you can also read with them. But some of the lenses would, really just make your vision clear at first. So if you're already over 50 and you initially needed reading glasses, you would still require reading glasses after the surgery. Like I said earlier, most of my patients, 55% of my patients, are very happy after cataract surgery. They have their vision back. But then you have the 5%, you have the, small number that, can develop complications after the surgery. So I would like to talk about the risk of cataract surgery. What complications your eye surgeon might not share with you or might not let you know before doing cataract surgery. A big complication that's more common in underdeveloped parts of the world is infection. If cataract surgery is done in an unsanitary environment or proper follow-up care is not done, the patient can develop an infection. This infection can actually lead to blindness. Thankfully, in this part of the world and in so many parts of the world, the risk of infection is actually low because the techniques for cataract surgery have highly improved over the years. Another issue that can develop after cataract surgery is dry eyes. What happens during cataract surgery is that when the incision is made, so your corneal nerves are damaged. Now, corneal sensitivity is so important in time when we talk about tear production. So when your nerves are damaged, that reduces tear production and you can start to get very dry eyes after cataract surgery. You can use lubricants, you can use eye drops to improve these dry eyes, but it can be very worrisome for lots of patients. Another issue that can develop after cataract surgery is droopy eyelids. That's because the speculum used to hold your eyes open can damage the eye muscle and lead to your eyelids to be droopy, especially if you already have slightly droopy eyelids, but have highly improved over the years. Another issue that can develop after cataract surgery is droopy eyelids. That's because the speculum used to hold your eyes open can damage the eye muscle and lead to your eyelids to be droopy, especially if you already have slightly droopy eyelids before the surgery. This can be fixed. If it's bad enough, you might have to have another surgery to fix that muscle. Another issue that can develop after cataract surgery is dysphotopsia. Now, what is dysphotopsia? Dysphotopsia is when you start to see light images like starburst, like rings, like halos in your vision. It can be very worrisome, even shadows in your vision. And this might be from the intraocular lens that was implanted in your eyes. For most people, they are able to cope, but if you're not able to cope, you might require your surgeon to change the intraocular lens so you're more comfortable. A big concern for most people after cataract surgery is floaters. What are floaters? Floaters are when you have dark spots in your vision. They can be like airlines and they move when you move your eyes. Floaters can be annoying, but they're just as a result of the gel in your eyes. So after cataract surgery, the gel in your eyes can collapse and basically start to pull away from the back of your eyes. And the reflection or the shadow of this is what you see as a floater. Okay, they're usually harmless, but they can be annoying for sure. I understand that. Another issue that can develop after cataract surgery is something called posterior capsular opacity. So PCO. What that means is that the lens that was implanted in your eyes, you can start to develop scar tissue behind the lens. And this can start even as early as the day of the surgery, just after they implant the lens. The surgeon can actually see that you are developing scar tissue behind the lens. This can be fixed with laser. It's a special kind of laser, a YAG laser, and it's usually a couple of minutes procedure done in office. Now, like I said, most people are happy after cataract surgery, and to reduce the chances of complication once you've had cataract surgery, you must follow the instructions that were given to you by your eye doctor. Drops will be given to you to use, usually antibiotic, anti-inflammatory drops, you use for a couple of weeks. Use it as instructed. Avoid swimming in the first 1 to 2 weeks. That's a critical healing period. Avoid swimming. Avoid heavy lifting. If your job entails heavy lifting, then maybe you might have to take some time off work to heal properly. Avoid being in any scenario that might result in a punch on your eye or any trauma, on your eyes, essentially, so that you can heal properly. Most people would heal within the first couple of weeks, within 3 weeks. After 3 weeks, 3 to 4 weeks, you can go get your glasses at that time because you would have healed, everything would have settled down. Bear in mind, after surgery, there might be some level of inflammation. That's common, and that's why you have the drops that will subside after a while. I really hope you enjoyed this video, and now you have all the information at the tip of your hands that you need to make the right decision and informed decision moving forward on your cataracts and cataract surgery. Please don't forget to like, comment, and subscribe to this channel. This will encourage me to put on more videos that, trust me, will be very educative and help you to know more about certain subjects as regards your health. As always, I remain your friend and favorite eye doctor, and until our next chat, continue to keep an eye on your eyes. See you next time.